My name is Dr. Ayla Wolf. I'm a doctor of acupuncture and oriental medicine and a licensed acupuncturist practicing at Healing Response Acupuncture and Functional Neurology located in Stillwater, Minnesota. Over the last few years of the COVID-19 pandemic, our clinic has worked with patients at the acute stages of infection, immediately after the acute stages of infection, where people still have a lot of lung and sinus symptoms, difficulty breathing, wheezing, coughing, and now with the Omicron variant, a lot of sinus congestion, headaches, ear inflammation, kind of muffled hearing, a sense of the ears being clogged, a lot of more upper respiratory type symptoms. And then lastly, we've also worked very diligently with people who are suffering from what is now being called long COVID or COVID long haul. It now has multiple different names depending on who you're talking to. And the difficulty about naming this experience, long COVID, is that the name does not convey the huge degree of variation between people. For many, this can be a loss of taste and smell that is persistent. For others, it can be alterations in taste and smell where certain things taste or smell very foul. But the reality is that most people with long COVID have not just one main symptom, but they actually have a pretty long list of new symptoms that arose after the COVID-19 infection or a worsening of pre-existing symptoms. The patients we treat often have headaches, extreme fatigue, poor sleep, muscle and joint pain, anxiety, depression, tingling, numbness, brain fog, autonomic dysregulation, and many other manifestations of neurological signs and symptoms. Because our clinic specializes in neurological disorders, it became our job to start diving into the research that continues to be published on all aspects of COVID-19 to understand what the mechanisms are in the body that cause such a wide variety of symptoms so that we could understand how to best help our patients. This is what we want to share with you today because this is the question that we hear from all of our patients is, why is this happening to me? Why do I feel like my health is crumbling away, and how can my health go so far off the rails after even having a mild case of COVID? There are important ways in which the SARS-CoV-2 or the COVID-19 virus is different from other viral infections and other colds and flus. When the COVID-19 virus gets into the lungs, it immediately interrupts the normal signaling of the body's own innate cytotoxic immune system, and it blocks it. So right out of the gate, that infection actually throws the immune system off balance. And that basically is insult number one. Then as the virus enters what are called type 2 pneumocytes in the lungs and starts to replicate inside those cells, a second arm of the immune system shows up and starts to create an inflammatory process to attack the virus and try to stop it. In this war that takes place in the lungs, there are byproducts. Some of the byproducts are from the virus itself, and these are called pathogen-associated molecular patterns, or PAMPs for short. And then some are from the body's own response, and these are called damage-associated molecular patterns, or DAMPs. This virus is unique in the fact that a much larger amount of these pathogen-associated molecular patterns and damage-associated molecular patterns are produced compared to, say, a cold or a regular flu. Now, I understand that this is likely the first time you may have heard anything about these molecules because they don't get their own headlines in mainstream news, but bear with me because this will actually answer a lot of likely your questions and certainly the questions that so many of my patients come in with. These pathogen-associated molecular patterns and damage-associated molecular patterns are produced in the lungs. And as a result of an infection, they get into the bloodstream. And from there, they can go everywhere. They can make their way into every single internal organ. They can make their ways into the gut and the digestive tract. They can get into the brain and the central nervous system, and even into the peripheral nervous system and the lymphatic system. And they can even affect the cranial nerves. So what happens next is very important to understand. These organs and the brain and the nerves and these tissues respond to these pathogen-associated molecular patterns and damage-associated molecular patterns by saying something is wrong, we are under attack, and we need to mount an inflammatory response. So even if the virus itself is not infecting the brain or the nervous system or the liver or the spleen or the kidneys or the heart or the blood vessels, all of these organs and tissues in the body can mount a local inflammatory response to essentially a ghost. In some very rare cases, we do actually see COVID-19 viral infections of the heart, the kidneys, the spleen, and the brain, and these often become very fatal or very life-threatening cases. So I'm not saying that this doesn't happen, but what I am saying is that in the vast majority of cases, the underlying mechanism for a systems-wide inflammatory response that can include the brain and the central nervous system is just what I described above. And if you would like to listen to an excellent conversation with Dr. Benjamin Tenover, who is an expert virologist who describes this inflammatory process, I'll provide a link to a podcast where he was interviewed because I think it's a phenomenal conversation in that podcast. My point of spending the time going into detail on this is because this inflammatory response is a huge piece of the puzzle when it comes to helping people. When patients come into our office, we ask a ton of questions. We do a very thorough intake and we do a functional neurological exam in order to understand what systems in the body have been affected by this inflammatory response, because it's different for everyone. Some people have more inflammation in the peripheral system. They can have joint pain, muscle aches, numbness, and tingling. Other people develop inflammation in the lymphatic system and can have swelling in the lymph nodes in the neck or other areas. So they can have a lot of discomfort in the neck area. And then other people can have inflammation in the central nervous system and have cognitive symptoms like brain fog, memory problems, anxiety, and depression, because inflammation can actually interrupt normal signaling and function of our neurotransmitters and of a lot of neuromodulatory chemicals in the body and in the brain. Every patient with long COVID is different, and every patient requires their own individual treatment program to get them back to health. And this is where we excel. Before COVID, our clinic specialized in working with patients with concussions, post-concussion syndrome, and traumatic brain injuries, and we still do. But the most important tenet of that process was understanding that every brain injury is unique, and every patient with a brain injury requires a tailored treatment plan. So our whole clinical model and our integrated approach, looking at the whole body and the brain and how all these different systems integrate with each other and rely on each other, understanding how everything is connected, and understanding how to provide a customized, tailored medical approach, that was already in place in our clinic. So we've taken this model that we've already been operating in, and we have been able to apply it to the population of people who are suffering from long COVID. In our clinic, we utilize a lot of different therapies. Our tool bag is very big. We create customized treatment plans for everyone, and we utilize very high quality, powerful herbal medicines. We utilize photobiomodulation therapies and hands-on therapies like acupuncture. Our goal is to improve the functioning of the internal organs that were affected by systemic inflammatory responses, remove the inflammation from whatever tissues were most affected for the individual, and bring the immune system back into balance, and support the organs that are responsible for clearing inflammation out of the body, such as the kidneys. Kidney function is one of the most important things to pay attention to when it comes to clearing these pathogen-associated molecular patterns and damage-associated molecular patterns out of the body. And that is a very important missing element in medicine at large today, is this lack of support for the very organs that are responsible for clearing inflammation out of the body. So much talk is focused around inflammation and stopping the inflammatory processes, but the important thing to recognize is that the body has to clear out the existing inflammation that's there. And the kidneys are largely responsible for doing that and making that happen. So when that foundational piece is missing, the whole treatment plan is less effective. Okay, we hope this information was valuable to you. We hope this gives you a better understanding of why and how so many different health issues and symptoms can occur as a result of a COVID-19 infection. And we hope that if you are still suffering, or if you know somebody who is still suffering and looking for answers, that you'll contact us and give us the opportunity to work with you and to help you. The road to recovery is not always fast or easy, but there is a road, and we will show you how to find it, and we will walk that path with you. To learn more about our clinic, you can visit www.healingresponseneuro.com, or you can contact us at info@healingresponseneuro.com. Again, my name is Dr. Ayla Wolf. I'm a doctor of acupuncture and oriental medicine and licensed acupuncturist and owner of Healing Response Acupuncture and Functional Neurology, located in Stillwater, Minnesota. Thank you so much for watching this video.